do you are you facing a problem like when you brush your teeth and you get blood in the mouth, like when you spit out there is blood coming out of your mouth and you're scared, oh my god, my mouth are bleeding. So this usually happens when you have poor oral hygiene. And whom of you have not suffered? Even I, when I'm on holiday or when I don't have to do much, even I sometimes get this problem of bleeding gums. So what is the main reason? What is it? It's called gingivitis in dentistry, and it is a periodontal disease. This happens when there is an inflammation of gums and bacteria settles between the gums and the teeth, and if left untreated, this can lead to periodontitis, which is known as the gum disease. And what are the signs and symptoms of gingivitis? So, the signs and symptoms of gingivitis are swollen, puffy gums, dark red gums, gums that bleed easily when you brush or floss, or you get bad breath and there is a receding gum when you look in the gum in the mirror, and your gums are pretty tender, and when you touch it or brush it you start bleeding. And believe me, that is all bad blood, like Taylor Swift. Bad. It's bad blood. It's not good blood. It's bleeding because it's infected. Your gums are infected and you're bleeding profuse. So the most common sign of gingivitis is poor oral hygiene, which I already told you earlier. If you don't brush your teeth before going to bed or after breakfast in the morning or before breakfast in the morning, I prefer to brush my eat my breakfast with a clean mouth. So, and this will encourage formation of plaque. Plaque is form. Okay, plaque. We'll talk about plaque later. And this plaque, it makes your gum inflamed, and it makes the surrounding tissue of the gums also inflamed because there is so much bacteria lodged between the gums and the teeth. So let's give you an idea what is plaque. Plaque form on your teeth, and it is a sticky film when starches and sugar in the food interact with the bacteria found in the mouth. This adheres to the tooth, especially between if the food is lodged between the gums and the teeth, and this is what makes your gums infected and the surrounding area. And if you keep it untreated, when that your gums will start receding, and then the final thing is your tooth start getting loose, and you might lose a tooth just because of this periodontal disease called gingivitis. So that is a long term problem, but if you can grip this, treat your problem right now, this can be stopped. Okay, so what happens to plaque? It turns into tartar. So where was I was talking about plaque. Plaque is the start. Okay, it's a sticky film that adheres to your tooth surface between the gums and teeth. Hold on, wait. Keep on holding. Here. Okay, let me show it in the teeth where it exactly forms. This is your tooth. So what happens? Oh, my nails all gone because of the quarantine. Here, plaque. If the plaque is formed in this area between the gums and the tooth, this is where this area get inflamed, and when you touch your teeth with a brush or something, you will get bleeding. Okay, so plaque will turn into tartar. So tartar is the second stage of plaque. All right, so what happens is plaque is what is plaque? Plaque, I already told you, is a sticky film. So plaque hardens and turns into tartar. Tartar collects bacteria, and that makes uh, tartar makes the plaque very difficult to remove. It gets hardened and it's become like a stone adhered to the teeth. So it creates a protective shield to the bacteria, and this leads to irritation of the gum lines, and tartar has to be removed professionally. If you are having bleeding gums, probably if you have not been cleaning your teeth properly or you have a bad oral hygiene, then this tartar you can even see in the like naked eyes. When you look in the mirror on the gum lines, then you could see here a black thing formed here. There, that is called tartar. All right, the whitish thing is black, and the blackish thing that is attached to the root surface is black. Not, I mean tartar. Punk. Okay. So once the gingiva is inflamed, the longer the plaque and tartar is attached or adhered to your tooth, the longer it will take time to remove them. It longer. I mean, the way, yeah, it will take longer time to remove it because we have to really use our dental instrument and stuff like that. And what will happen if the tartar and plaque is attached to the teeth like that? It will irritate the gums. Yeah, it will irritate the gums, and the gums become inflamed, and the gum will be swollen, and gum will bleed profusely if you touch it or brush it. And this will also lead to tooth decay because the plaque is already formed in the teeth, and then you will make pocket formation in the gums, and then the food is lodged there, so it could lead to tooth decay also. So, so what we can do? So there is tooth decay happening there, and the more plaque is on the root of the teeth attached there, the more loose the teeth will become because mm, uh, because there will be decay of the tooth surface, and this will lead to receding gum lines. Then that will lead to the mobility of the tooth, and in future, I have told you before also, there will be tooth loss, just like that. It will just come out like that. Let me explain again. All right, I have an example here. Suppose this is your tooth. Of course, this is a sample of tooth. I got this from Sirona World in Las Vegas. Somebody gave it to me in the dental booth. Nice to be cute all the time. Anyway, I brought this from Las Vegas dental conference. Anyways, this is a tooth, all right? And suppose this is your gum, the black thing is the gums, and your plaque and tartar is here. So more you don't brush or take care of your oral hygiene, and the plaque is formed in this area, and tartar is also formed after the long time, it forms into tartar. The plaque forms, make a covering of tartar, which looks like a stone, I told you. So it gets lodged between the teeth and the gums here. So the more it is formed, it's going to inflame this area, the gums, and the gums, okay, and the gums start to recede like this. It's like this. Mine, too. I don't have time to go to manicure pedicure because it's quarantine, so everything is closed. So excuse my nails. So it will go like that, like that, like that. Okay, that will just falls off. So that's what I want to explain. That will, like, if you don't take care, you will lose your teeth. So better take care when you're young. I know a lot of my people who watch this are very young, so it's better to catch the problem when you're young, even if it's your dental for your dental health. All right. So, what are the causes or the things that increase the uh, chances of you guys getting gingivitis or bleeding gums? First is number one is poor oral hygiene. Number two, smoking. I don't smoke. Do you smoke? Smoking is so bad for you. You know, I just hate people who smoke because it's so bad for themselves and more bad for people around them. It's so bad for your lungs. So number 3 is chewing tobaccos. Number 4 is dry mouth. Number 5, number 5 is poor nutrition. I'm sure you're getting enough of your nutrition current. Everybody is eating so much. There is also because of vitamin C deficiency, dental restoration, decreased immunity, like leukemia, HIV, cancer treatment drugs also, get you gingivitis. And sometimes it's because of genetics or medical conditions like viral or fungal condition. Even pregnancy, when you're pregnant, you get gingivitis because of weakness. Immunity goes slow, and that's why. So if you have deficiency of vitamin C and K, that also gets you gingivitis. So what are the complications of gingivitis? If you don't treat gingivitis, you'll get gum disease, you'll have problem to the underlying tissue and the bone, and like I told you earlier, it will give more serious condition is it leads to teeth or tooth or teeth loss. And how can you treat it? It's better to use the preventive measures of brushing your teeth and taking care of your teeth and gums and keeping them healthy. Because if you have to go to your dentist every 6 months to clean it, which is called, we clean it professionally at our clinic every 6 months. But now I don't think anybody will go to is going to a dentist. So even I'm absolutely free right now. So what you can do is take care of your teeth. So where was I? So if you keep your gum gingivitis untreated, it will lead to progressive gum disease or periodontitis, which I already told you will lead to teeth loss. Now I'm going to talk about the bad guys. What will happen if you have chronic gingivitis, gingiva inflammations? Chronic gingival inflammation is associated with some of the systematic disease like respiratory disease, diabetes, chronic artery disease, coronary artery disease. It can lead to stroke. Oh God, that's scary. So, I always use this floss. I don't like the usually the floss. Flossing is actually so good because it's like having a dentist at home, and I like this because they are much better, easier to use. You can get into all your tooth area like this. You can go like that and clean it properly. So because you can get a stroke just because you are having gingivitis. Okay, and you can get rheumatoid arthritis, and some bacteria are responsible for periodontitis. And what happens is the bacteria can enter your bloodstream through the gum disease and possibly affecting your heart, lungs, other parts of your body. So in short, because we are all related, your gums are connected with your body and your whole artery system, your blood, capillaries, whatever, it's connected. So something that happens here can go anywhere in your body, and this is why we have to take major care for cleaning your teeth. So if you're like, okay, I'm a dentist, I'm also quite lazy. So if you're like me, you can use anti-gingivitis toothpaste. So easy. Or anti-gingivitis mouthwash to make your work easy. And brush your teeth and gums at least twice daily for 2 minutes. if you're using the regular brush. But if you are lazy like me, you can use, so if you are lazy like me, you can use electric toothbrush like that. It makes it so much sense for lazy people like us. You can get that, you can buy them online, and it's easy to clean it with. It's like having a dentist at home or a hygienist, dental hygienist at home. And what else? So you have to replace your toothbrush every 3 months, which we all know. And if you have sore gums after flossing or brushing or notice bleeding, don't stop brushing or cleaning. Don't be scared. Let all the bad blood, like that song, Taylor Swift, Bad Blood. Yeah, like that. I think whenever I hear that song, she's talking about bad blood. So that is bad blood. So you just have to flush it and flush it out of your mouth. Just gargle it out. You can also use hydrogen peroxide mouthwash. It's so good for you. You can use normal baking soda. It's so good for your gums. And check your gums on the mirror ever so often when you're applying your lipstick. And just consider going to a dentist when all this is over. I would not recommend you to come to me in this time. This is too dangerous, and all those dentists wearing all those gowns, scary. But if you are brave enough, go for it. I can't make decision for you guys. So so today I taught you about gingivitis, guys, and please brush your teeth after you wake up. That's the best time to brush, and don't forget to flush. Flossing is so important to take care of your gums. And like me, if you are lazy, use this, buy this kind of floss and just flush it everywhere. Think you're doing a favor to your heart, because when you grow old, you don't want to have a stroke, or because it's a progressive disease. Gum disease doesn't happen one day. It happens from day to day for last 6 weeks. Probably nobody is brushing their teeth or flossing before going to bed, because we are all watching Netflix and just dozing off there. So go to the bathroom, take your brush out, put the toothpaste, and just brush, sing some song, just brush and clean your teeth. And if it is bleeding, don't be scared. Let all the blood come out, but be very gentle when you brush. And in my next video, I'll teach you how to brush your teeth and how gentle you have to be and how loving you have to be to the gums. All right, bye.